Hello and welcome to Health Matters on Channels TV. Thanks so much for joining us. I am Mary Alale Yusuf. The thyroid is a small gland at the base of the neck, weighing a mere 20 grams. Yet this little, supposedly insignificantly sized gland has an effect on almost every tissue in the body. The heart and the bones are just two of the organs that the thyroid has effect on. This is a butterfly-shaped structure and affects those two organs as well as many others. According to the Thyroid Foundation, about 200 million people have some form of thyroid disease, and disorders are 4 to 7 times more likely to happen in women than in men. Dr. Ukandu Igwe is on the show with me today. Dr. Igwe is a senior registrar in the Department of Endocrinology, Diabetes and Metabolism at the Lagos University Teaching Hospital, Idiaraba. We'll be discussing about the thyroid. You're welcome to the show, Dr. Igwe.
Thank you.
The thyroid has effect on so many organs. What does it do?
The thyroid gland, like you say, is a very little organ in the body, is in the neck. It's little in size, but its effects are widespread. It has effects on virtually every organ in the body, from the brain, the muscles, the heart, the bone, our guts. And those effects are majorly positive. What it does is it improves metabolism in those organs. And the effects are noticeable even before birth. So the thyroid gland has effects from inside the womb on the development of the brain, especially all nerve tissues, the muscles. And after birth, the thyroid affects our function. So the products of the thyroid gland, which are thyroid hormones, affects our metabolism. They affect nerve function, normal functioning of the muscles, of the heart, and many other organs in the body.
If there's a malfunctioning of the thyroid gland, what kind of disorders could come up from that?
There are many malfunctions of the thyroid gland, and we can group them into underproduction or overproduction of thyroid hormone. The effects of the thyroid gland are accentuated in overproduction of these thyroid hormones. So, like I said, they affect the development of the brain, they affect our alertness. So when there is overproduction of the thyroid hormones, there could be features like anxiety, shaking, even poor sleep. Then it can also lead to a faster heartbeat, excessive sweating, weight loss, because the metabolism is faster than it's supposed to be. It has effects on the gut. So someone with thyroid disorders may have to use the toilet more frequently than
that's when it's
when it's overproducing the hormone. We see the opposite of those effects in underproduction of thyroid hormones. The effects of underproduction of thyroid hormones are not as dramatic as the effects of the overproduction, and they usually happen over a long time, and they include things like mental sluggishness, apathy, withdrawal, depression, sleep disorders, then the opposite of using the toilet frequently. So someone with constipation can be as long as 5-6 days without using the toilet. The other effect too is on the brain development. So a baby forming in the womb may have developmental abnormalities that may even make him to have a subnormal intelligence after birth if he didn't have enough thyroid hormone during development.
Can the levels of thyroid hormone be measured in fetuses? I mean, with the intention of correcting the levels before the child is born, since it has such devastating effects.
The measurements of the thyroid hormone levels in the fetus is not something that is done routinely, because one, it is quite common, it's a very common disorder, and then secondly, and most importantly, it's a very invasive thing. You do not easily, you need to reach to the baby in the womb developing to draw blood to measure that. So we measure it indirectly from the mother's
Okay,
blood.
that is possible.
Yes.
You can tell if the baby might be having a thyroid problem from the mother's own.
You can predict, especially if it's a mother who had a thyroid disorder before pregnancy. Again, we do not screen every pregnant woman routinely for thyroid disorders, but people who have some problems, like they have a goiter, that is an enlarged thyroid gland, or they were known to have a thyroid disorder before pregnancy, or they have a strong family history of maybe their siblings or mothers who had thyroid disorders, or we have a reason to suspect that there might be thyroid disorders, those kind of women we may
be checked.
Yes.
So you're saying that thyroid disorders can be hereditary?
They can be, yes. There's a very strong hereditary factor to it.
Okay, let's backtrack to this hormone. Why would there be an underproduction or overproduction of this thyroid hormone? What could be the cause?
There are many reasons why there's, let's call it, excessive thyroid hormone levels in the body.
Hyperthyroidism.
Hyperthyroidism.
It's okay.
We will prefer the term thyrotoxicosis.
Okay.
Now, there are two terms that sometimes are used interchangeably, but there's a little difference. There can be excessive thyroid hormone level in the blood from people who take synthetic thyroid hormone for many reasons, either from treatments in the hospital where we give them to correct the underproduction, or some people use them, or they used to use them as weight-losing pills.
Okay.
Because of this effect that I talked about, increased metabolism, it can lead to weight loss. But that is the wrong use of it, because it affects other organs.
Affects other organs, and cause
the
probably
side
unpleasant
effects
symptoms.
outweigh the benefits of the weight reduction. So that is one cause of excessive thyroid hormone level in the blood from usage of tablets, inadvertent or deliberate usage of it. The other causes of excessive thyroid hormone levels, which is the one that you would call hyperthyroidism, if the overproduction is from the thyroid gland itself, sometimes it happens from a compensation or from an adaptation to the level of iodine in the body. If there is excessive iodine in the blood, iodine is a substrate that the gland uses to produce these hormones. The thyroid gland actually uses up more than 90% of the iodine level we have in the body. So when there is an excessive supply of iodine, you're supplying more substrate, so the gland will go ahead to produce excessive quantity of hormones. So that is one cause of excessive production. There are many other causes of excessive production. Sometimes the gland just assumes what we call autonomy, just on its own without any stimulation, goes on to produce excessive amounts of thyroid hormone. There are some other things that affect the regulation of thyroid hormone production, including the control from the pituitary gland. The pituitary gland is a very little organ in the brain that controls other organs that produce hormones. So it can give a signal, like you said, to produce more thyroid hormone due to some dysregulation. So that could make the thyroid gland to produce excessive thyroid hormone.
But isn't there supposed to be a sort of negative feedback for something so important? That's maybe when enough hormone has been produced, something happens and the body says, that's enough, let's not do anymore. Isn't there something like that happening in the body?
Yes, there's a negative feedback control, like you said, in the production of thyroid hormone. What the feedback means is the pituitary signals the thyroid to produce thyroid hormone, and the thyroid hormone fulfills its function in the various organs that we've mentioned. And in return, it feeds back to the pituitary based on the level of the thyroid hormone in the blood, so that the pituitary will stop stimulating it further. But in some conditions, the pituitary may have lost that ability to get turned off by the thyroid hormone. So the pituitary is just increasing the signal for the thyroid to increase the output in spite of the level of the thyroid hormone that is already in the blood.
Is there a way to reactivate this negative feedback as, a means for correcting the problem?
Actually, most of the causes of overproduction of the thyroid hormone are not from the pituitary.
Okay.
They occur, but they are not as common as the disorders that arise from the thyroid gland itself.
Ooh.
So it's as if the thyroid gland is producing the hormones irrespective of the signal from the pituitary. In fact, most people with excessive thyroid hormone production, that is hyperthyroidism, have the pituitary hormone shut off, so that in spite of the reduced or suppressed signal from the pituitary, the thyroid gland still produces excessive thyroid hormone.
They have the pituitary shut off. I mean, medically, is that one of the interventions?
That is not that is the reaction of the excessive thyroid hormone. So
Okay.
because of the excessive thyroid hormone in the blood, the pituitary gets shut off.
Okay.
Which in a way is good because you don't need more stimulation to the thyroid.
Yes,
from
indeed.
the
But you said the pituitary also regulates other organs in the body. So how does that play out, with the other organs? Doesn't it affect other parts of the body?
The pituitary has many signals it sends to different organs to affect
So
their
it will be an
function.
independent sort of thing.
Usually should be, although sometimes the effects of a hormone on other organs may be related, but usually when you treat the thyroid disorder, if there's any other effects on other organs, they will correct. For instance, the excessive thyroid hormone level can affect the menstrual cycle, for instance, or things like sexual function. The treatment for that is just to treat the thyroid disorder. You do not need to be giving hormones to affect the sexual function. So once you address the primary disorder, the menstruation will come back to normal as it were.
We need to go on a break right now, a short break. When we come back, we'll continue from that point. We're going on a break and we'll be back shortly. Then you can call in and ask your questions. Stay with us.